disabilities or issues that go along with autism can be ADHD, attention deficit and hyperactivity disorder, epilepsy, having seizures, Down syndrome, typically with mental retardation, cerebral palsy, muscular dystrophy, Tourette's syndrome, where individuals have a difficult time moderating their speech. They may have tics and unusual behaviors. We have some individuals that grab their crotch, that continually do a eye movement or head movement. And tuberous sclerosis or neurofibromatosis, those are specific brain lesions that can cause signs of autism. So these go along with, we call it being comorbid with autism. Secondary, these are disorders that result from having autism. So they don't go along with it, but they are a result of having autism. Secondary disorder can include things like anxiety, mood, particularly depression or bipolar disorder. It also happens if you have higher familiar rates of mood disorders. And you can have conduct disorders, and it's unclear whether these disorders are characteristics or whether they occur due to stress or frustration. Conduct disorders are typically, that categorization is reserved for students who do not display remorse when they undertake an act that's antisocial, could hurt animals, or not have any feeling toward an animal or another person. That may be called a conduct disorder. So these are possible secondary disorders. Again, a great deal of variety among the population. If we look at gender and autism, we have a higher rate of autism occurring in boys. Autism 2-to-1 in favor of boys, and Asperger's 5-to-1. So you're going to probably see more boys having autism and that of Asperger's syndrome. Now, if you look at the clinical picture in response to treatment, is it different in boys and girls? Well, yes, it makes sense. Clinical experience suggests that girls with Asperger's are better at hiding their social confusion. Girls in general are, and respond better to programs teaching social understanding. So the old, I don't know if it's an old theory, but it's been shown that girls tend to have greater social skills at a younger age. This may have a bearing on this, that they're able to hide that social confusion that goes along with their label, and they can respond better when they're taught social understanding. We look at the autism rates. In the 60s through 91, we had 1 in 2,273. If we're going up into the 1990s, we have a prevalence of 1 in 787. And if we get to 2007, we have 1 in 500 to 1 in 1,000. I have actually heard of rates even higher than that. I've heard as high as 1 in 20. I'm not sure I believe that. The counts are very difficult to get because kids are categorized differently in different districts in different parts of the country. But this is an estimate. Now keep in mind that individuals with autism were not identified as a separate category in the educational system until the 1990s. So very often these low rates meant that they were grouped with individuals having severe disabilities, other health impairments, rather than a separate category of autism. So these rates are going up. There is no question about that. Whether or not we have specific incidence and prevalence rates, probably not, due to identification issues. But we have rising rates. Some people call it an autism epidemic. That increased rate, we don't know. It can be due to that we define autism in a broader way. We've included more things within it. We can say that children can now be diagnosed with more than one developmental disorder. In the past, children with intellectual disability were not evaluated for autism. That may be a difference. And one that I really believe is that we've become better at recognizing and diagnosing the symptoms. We have a great deal more public awareness. In fact, almost a hyper-awareness of autism. And so we're able to recognize these symptoms a little better and therefore can earlier and with greater ease identify someone who might have an autism spectrum disorder. So in conclusion here, in terms of autism, although autism is a lifelong disorder, the prognosis is really much better for persons than in the past. For many on that spectrum, the best outcomes could include things like a full-time job, living on their own, marrying, having children. So it is not a sentence that means you're going to be living in an institution, you're going to be incapacitated, or that you won't have a good quality of life. Something to keep in mind that there are no miracle cures for this, but intervention can greatly help improve the outcomes. The challenge in this is to the huge increases in referrals without the proportional increase in resources is difficult. We have many more referrals of children having autism, but we're mainly not getting the proportional increase in the teachers that are trained, in the specialists that are required to help this population. So we've got some challenges in terms of system change to handle. But this concludes our first part dealing with characteristics of autism. Okay, now we're on part 2 of our session 1, and in this part we're going to be looking at the brain behavior connections in autism. And this correlates or corresponds to chapter 2 in your textbook. This chapter was written by Nancy Minshew and her colleague. Nancy is out of the University of Pittsburgh, and she's done a lot in terms of brain research in individuals with autism. So you're going to find some results in this that deal with her research on this issue. Differences in the brain. People with autism think and perceive differently because of differences in their brain. So there is a basic neurological difference. Brains can differ in their size, the way they are functioned, and the way they are organized. Now, there have been 2 approaches to researching the neurological basis of autism. The first is that you look for a single or core deficit, and you may have heard that term, that causes a cascade effect resulting in the entire constellation of deficits in autism. So you might have one core issue within the brain, and this in turn impedes this and this and this and this and this, and you have that cascade effect. That is one way or one approach to researching the basis of autism. Another is to investigate the evidence of all the simultaneously occurring impairments and looking for common denominators. This is more likely the course of action that's taken now, because the traditional approach of neurologists isn't working, because the brain abnormalities rarely result in just a single impairment. You have impairments that occur together. So investigating evidence of all those simultaneously occurring impairments is the more common way to research the neurological basis. Now, Minshew and her colleagues and some others have done some studies that look at individuals with HFA, and remember that stands for high functioning autism. And they found these commonalities both in terms of intact or enhanced abilities and that of weakness. The intact, meaning they are appropriate on level, or enhanced, better, include things like attention, sensory, perception, elementary or simple motor, simple memory, formal language, rule learning, visuospatial, being able to see things spatially. And then the weaknesses have included things like complex motor skills. So motor skills that might require you to do 2 or 3 things together, different motor movements. Complex memory, complex language, concept formation, and face recognition, understanding what someone's face is telling you. Minshew suggests that when we look at those studies taken together, this indicates to you that the acquisition of information in autism is okay. It's intact. They get the information in the same way. but the information processing capacity is reduced. So this in turn affects what we call higher order information processing, the more complex things. And that capacity to process information when the demands of the task or situation are high are reduced or constrained. So we've got acquisition being intact, but we've got something happening with the processing that makes it different. These results of the studies also suggest that autism affects more than just social skills, communication, and that behavior, what is identified by the DSM, but it also includes things like motor, memory, and those are not included in the DSM. These results suggest that the basis of autism involves a mechanism that's general to the basic development of the brain's architecture. So something is different in the brain, and it's more than just those three, social, communication, and behavior, but probably should be extended to that of motor and memory, because this is particularly true with complex tasks. Now, if you look at language processing, if we're looking at sentence, when there is a clause in a sentence, what we call a complex sentence, the brain's got to do a few things. It's got to process the meaning of the first part, got to hold it in memory, you've got to process the meaning of that second part, and then you've got to put them together. Process the first part in relation to the second part. So if I give someone with autism a sentence or a question that says, would you please put, before you put the salad dressing on the table, will you make sure that you get the salad out? All right, so we've got a complex sentence. We've got two parts to it. We've changed the order of things. So I know that before I get the salad dressing out, I've got to hold that in my memory, I get the salad. Okay, that's my second part. So now then I've got to put them together. What am I supposed to do for the first part of the sentence and the second part of the sentence? So language processing, particularly with complex sentences, is difficult. Think about the classroom implications for this. How might that information processing difficulty affect a student who's in a classroom? So think about a student who needs to take notes while the teacher's lecturing and at the same time writing on the board. Lots to take in. Simultaneously interpret another student's words, facial expressions, tone of voice, and body posture, because all of those can tell you different things. If I say, man, that was really good, that's very different than saying, that is very good, and smiling. So I've got lots of different cues to take in. Follow directions, such as this. Before you line up quietly for recess, I want you to make sure your books are put away and your worksheets are in the basket on my desk. So many complex parts to that sentence that you're going to have to put in working memory. And if you think about these kind of activities, they very, very often go on in classrooms. Very often, very common for students to have to follow multiple cues in complex instructions. So very difficult. If you're looking at those studies and how they might affect learning, some of the best practice when you're teaching students with autism is this: convey that information succinctly and use as few words as possible. So keep it simple. Also, allow some time to process the information, and that means give them some time to think.